This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Pittsburgh to Scranton and from Erie to Philadelphia, it's Behind the Headlines. I'm Charlie Greenawell, Senior Fellow of the Susquehanna Valley Center for Public Policy, and I'm joined by my co-host, Mara Donnelly. Mara, welcome.
Hello, Charlie.
Mara, you can tell it's election season, can't you?
It's been election season for quite a while, it seems.
Well, the old adage is during election season, you'll see road construction everywhere. And I don't know about you, but everywhere I go, I'm running into road construction like I haven't seen in two years.
Here I thought it was just summertime. Turns out it's election season.
Well, and it's not only election season, it's back to school.
It is.
Time. Back to school at all levels, and that includes college. Yes, I saw a wonderful sign the other day, and it says, "Do your homework, your dog is hungry." But to talk about this, we have with us the president of APSCUF, our statewide faculty union for the 14 state universities here in Pennsylvania, Ken Mash. Ken, welcome back to the show.
Hi, Charlie. Hi, Maura. It's great to see you again.
We have you at a very critical time, at a very important time, because the faculty union has been trying to come up with, develop, negotiate a new contract with the state system for how long, Ken?
Well, it's been over 400 days since our contract expired. We've been negotiating, I think, for 15 or 16 months. And so we've been working hard at it to try and get a deal done.
Mm-hmm. It's not going well, is it?
It isn't going well, but I do want to back up for a second, if I could, and just say that for my members, this is, it is the most wonderful time of the year, because we really do look forward to a great experience and creating a great experience for our students, and that's kind of what we live for. So these other things that are going on are really nothing but a distraction.
Well, there was a lot of coverage this week showing a lot of the professors helping the students move in, which I think is great. It's always been the students helping students, but a lot of professors this year, which is great.
That's something that's done on our campuses every year by faculty.
That's wonderful. Yeah, very nice. It is that time of year.
So what is the latest outlook at this point, Ken? Are negotiations moving along well now? Are they haltingly being conducted? Are they not moving at all? What's your outlook?
Well, we went for months and months without the state system really putting anything on the table at all. And in fact, we went through one period of 4 months where we didn't have any kind of negotiations at all. Eventually, a couple of months ago, they did give a full comprehensive proposal, and they put 249 changes that they wanted to make on the table. So that's.
Ken, let me interrupt you there. Did they say why they would not negotiate for extended periods of time?
They had changed attorneys, but really it didn't feel like to us that there was any sense of urgency that they felt to try and get this done, which is something that I think is upsetting, because it does create this kind of scenario ultimately where our attention of everyone is being distracted by these issues. We have in the most recent negotiation sessions reached some agreements on some very small matters that really would just be the concern of the system and the faculty as far as process issues and things of that sort. But when it comes to the big issues, the big things that they want to do, which we believe impact the quality of higher education that we offer, and things like salary and benefits, we are miles and miles apart.
So what exactly are those big sticking points?
Well, when it comes to quality, we're talking about what we believe is that they want to, when it comes to distance education, they want to increase the use of distance education, not just solely for access purposes, that is to reach populations that can't otherwise get to campus.
Which is a good thing.
Which is, we agree, is a good thing. It is the purpose, really, of distance education, we believe. But they want to increase the use of distance education for our students who are on the campuses already.
What?
And And for us, that's problematic. And we at least believe that there needs to be enough sections available for students to be able to take the class, with a professor, with other students, if that's the way that they want to take the class. We also have issues where they want to increase the number of adjunct faculty, that's the temporary faculty who come in, who are not necessarily credentialed in the same way as the permanent faculty.
Again, let me jump in here, Ken. The reason that many folks want to increase adjuncts, administrators want to increase adjuncts, is they don't have to pay them benefits.
Right.
And they pay them lower levels of compensation. Isn't that true?
Right. We say they're trying to exploit these people because they really don't pay them the same sort of wages. There isn't any kind of hope for a permanent position there. They want to increase the use of them from, right now they can use up to 25% of our faculty can be temporary. They want to up that to 30% and maybe a little bit more than that. But at the same time that they want to do that, they want to, in essence, lower the salary of those temporary faculties by 20%. So, they really want to, use these people as much as they possibly can. Now that impacts quality, again, because you're not going to get the same permanent faculty who are credentialed in the same sort of way, but also because they are, in essence, increasing the workload. To be full-time, if you're a temporary faculty member, you'd be teaching 5 classes. To be making relatively low pay, that means that you're doing all this much more work. And then they want to increase healthcare costs for these people too. They may wind up teaching those 5 classes, going to teach somewhere else, and then ultimately you're starting to think, what kind of attention are they even giving to our students? And then on top of that, they want to make use of what most people call teaching assistants. We call them teaching associates at all of our campuses. Right now, only IUP uses teaching associates because they have doctoral programs. The other campuses, only a couple of them have doctoral programs and their professional degrees, but they want to make it so that students who are pursuing master's degrees can teach courses in lieu of permanent faculty, in lieu of even these temporary faculty members who have degrees. And ultimately, we think this hurts the quality of education that we provide. And it's not something that we're just going to sit by and let happen, even for increases. Even to keep our benefits, we're not going to allow that to happen because it goes to the core of what we do.
Where do you think these ideas that the state system is promoting or trying to push came from?
Well, I think ultimately they are a response to the lack of funding for the state system. We're not the only state that's in this situation or close to it, and so they've used some of these mechanisms in other places. So I think that the root cause is the amount of money that there is for the state system. Last year, Pennsylvania ranked 48th out of 50 states for funding for public higher education. That means we're in the company of, Mississippi and Louisiana, and that's really not where Pennsylvania should be. But by the same token, what they've done in response to that lack of funding is increase tuition, which puts an increased burden on working families already. And now what they seem to be wanting to do is trying to balance their books off of the faculty. And that's not a path to success. So, we really need our chancellor, we need our university presidents to do a far better job of advocating for the state system of higher education. We benefit, hundreds of thousands of students over the years. We have an economic benefit for the Commonwealth. The research shows that for every dollar that's spent, state dollar that's spent, $11 goes back into the community. So it's a good deal, and of course, if we're going to bring good jobs to the Commonwealth, if employers are going to want to come here, right, then we're going to have an educated populace.
Well, let's talk for a second about what the process is going to be over the next month or so. We know that negotiations have kind of broken down and that there's the potential for a strike authorization vote within your organization. So can you talk about what the process would be and ultimately what you'd like to see happen? And is it too late to turn this ship around and get things settled?
Well, I've told the state system and I've told people in the media that we will do everything we need to try and work out a deal. That is what we want to have happen. So all of our energy, I'm going to be going to negotiations, pretty much from here. We will put all of our energy into doing that. But by the same token, we're not going to be stupid about it. If we need to take some other action, we will. So there's going to be a vote on the campuses in early September where members will make the decision, do they want to authorize the leadership to call a strike if necessary. And I'll just say that that's the last thing that anybody wants to see happen.
Right. Well, that would really impact things. One of the headlines I saw was that the universities would close. Do you think that would be the impact of a strike? Or, I mean, it sounds like it would. But
well, I mean,
what are you going to do?
The reality is this. Again, I'm going to start off with nobody wants to see
Right.
that happen. But you know, if we are the professor, we're the faculty, and we didn't even talk about the coaches who are in a very similar situation to us.
And they're going to be potentially authorized.
The following week
Yeah,
after
exactly.
us, because of, again, they're running into the same sorts of issues. But if you're going to have to take a job action, then your goal is to say, we're going to, you know, shut the place down. And I don't mean literally shut it down so nobody can go in and or out. But what we mean is there won't be any teaching going on, and the services we provide will stop. And I think that our colleagues are wise enough to see, in fact, I know that they are overwhelmingly wise enough to see that the issues that we're talking about are so important that they must be supportive. And we've gotten nothing but great support from our members.
Now, as we talk about this issue, and perhaps it's useful to remind the public, if I'm not mistaken, Ken, APSCUF has never struck in its long history. This would be quite a departure from a sort of accepted custom, or what has been the custom. Who actually is APSCUF negotiating with? Are you negotiating with the Board of Governors, with the Chancellor, with the legislature, with the governor? Or are you negotiating with some kind of mysterious combination of all of these? Who are you negotiating with?
Well, I do think in some ways it's all of the above, right? So
Ultimately,
all of the above. Technically speaking, we negotiate with the Board of Governors.
How do they come up with a position if all of them have input?
Yeah, well, I think it's the Board of Governors, technically speaking, but there's a lot of input there from the Chancellor of the state system. And then there's political forces at work, both forces that, are not necessarily favorable to unions, not necessarily favorable towards increased money for public higher education. And then the governor's office as well is trying to, have an impact on what we do. So it does make negotiations much more difficult, I think, at times, because we feel like we're negotiating sometimes with the board, sometimes with the chancellor, sometimes with the university president, sometimes with the legislature, sometimes with the governors. So it makes it a little bit more difficult.
Well, I'd really love to see us end on a positive note. And so let's make that, it's really not what you don't want to strike. You really want to be teaching.
We will do whatever we can do to reach a contract to make this the best semester for our students that it could possibly be.
Okay, and on that note, Ken has to run
to negotiations.
to go to negotiations now. So stay tuned for the second segment of Behind the Headlines. We'll be right back.
Behind the Headlines is brought to you as a public service by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The council works aggressively to define key long-term policy strategies and solutions to make the commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by Blackford Ventures, LLC, a private equity firm seeking to make significant investments in real estate, proven business enterprises, and their leaders. Find out more at www.blackfordventures.com. And by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On the second segment of Behind the Headlines, Maura and I have with us the Pennsylvania Secretary of Health, Dr. Karen Murphy, and we're so pleased that you could join us. Thank you so much. There are no shortage of health issues in the national news, in the international news, and statewide. So we're very grateful that you could spend the time with Maura and I today.
Happy to be here.
Well, we wanted to start out by talking about the crisis we hear so much about in the news, and that's the opioid crisis. First of all, I was wondering if you could share with our viewers what are opioids and why is this such a crisis in the Commonwealth?
So for your viewers, opioids are a certain type of pain medication, Percocet, Vicodin. The crisis has really evolved over the last 10 years, but it has really reached catastrophic proportions. So many of these people that are afflicted with opioid addiction, which is what the issue is, have started to take opioids for pain relief and become addicted to them. They're highly addictive drugs. And then many, which were also facing a heroin crisis, many of those who are addicted to the pain pills go on to heroin addiction. And it has been absolutely devastating. It is the worst public health crisis I've seen in my career, and we're losing 10 Pennsylvanians a day to drug overdose in the Commonwealth.
Well, why all of a sudden does this seem to be such a huge issue? I mean, opioids have been out there forever. Heroin's been out there forever.
They have been. I think the magnitude of the number of deaths and the magnitude of the addiction has really now not only on a statewide but also a national attention as the major number one public health crisis in America today.
Wow.
How has this evolved, continued to evolve, Secretary? Because here at Susquehanna, we were, I'd like to think, in the forefront of working with the Pharmaceutical Association and working with some folks at the Hershey Med Center to work with Senator Vance to promote, and ultimately the state adopted this new system that all drugstores must abide by when someone has a prescription that contains these substances. It's put on the computer right away on this website, so that individuals cannot go around and go prescription shopping or doctor shopping to stock up on Percocet. How much has that system helped, or didn't it go far enough?
Well, we just launched the prescription drug monitoring program last Thursday. Was our first day that it was live. And while the purpose is to identify those that are having a problem with prescription drugs, the real purpose that we're advocating for is that when these people are identified, that the physicians or the nurse practitioners assist the patient in finding treatment. And that really is what we're trying to do, is to identify individuals who are addicted or abusing substances and find treatment for them.
Is that to try to get them into a drug treatment program or a pain management program, or both?
The most appropriate that the physician,
Right.
that the physician
So it could
feels.
be a combination.
It could be a combination
Okay.
of both.
Wow.
We hear that the opioid problem is, some people maintain that it's worse in rural areas than in urban areas. Do you believe that's true? And if so, what evidence do we have of that?
The statistics do show that the increase in overdose hospitalization and deaths are worse in the rural areas of Pennsylvania than the more urban.
Why would that be so, Secretary?
I think that we have, when we look at all health outcomes of rural versus urban areas, rural areas tend to have worse outcomes in all chronic diseases. The opioid crisis may be that there's fewer treatment centers available. But there are low physician population in the rural areas of Pennsylvania. So it really is typical, though, of rural America. The situation is the same in Pennsylvania as it is across the country.
Well, I know that you can't be managing this crisis on your own, so you're probably working with other departments. I know the Attorney General's involved, so do you want to tell us a little bit about what's been going on within the state?
Sure. The governor really identified this as a priority, I think, the week we started in the administration. And we are working across agencies. So the Department of Health has launched, as we talked about, the prescription drug monitoring program. In addition, the Physician General, shortly after arriving, wrote an order, a standing order for naloxone for that's a drug that reverses opioid overdose.
Right.
And she has been
Very successful.
very
too.
successful
Yeah.
and doing a terrific job at promoting naloxone across the Commonwealth and access to naloxone. The Department of Drug and Alcohol is working on expanding treatment, also working on guidelines for prescribers, working with medical colleges to revamp the curriculum for opioid prescribing in medical schools. The Department of Corrections is working on assisting those that are incarcerated for treatment post their incarceration. And also the Department of Human Services announced this year that they are expanding to 20 centers of excellence for medication-assisted treatment. The federal government will supply $5 million to the budget, and the General Assembly voted for $15 million for these centers of excellence that will be across the Commonwealth.
Can we get ahead of this?
I think it's going to be a long battle.
It's not going to happen overnight.
It's not going to happen overnight. I think that it is a very complex issue. I think we have to start and emphasize prevention in school-age children and colleges. I think the education is out there. We have the awareness now, but we have to figure out in terms of effectiveness and really use this multifaceted approach to this issue.
Good.
What are some of the steps that other states are taking that are working, Secretary?
Other states we're the 49th state actually to do the PDMP. Other states are using prescription drug monitoring program.
Thank you.
So other states are using prescription drug monitoring programs. They are also expanding medication-assisted treatment that has shown some evidence of assisting those that are addicted to opioids. Medication-assisted treatment is not in and of itself the answer, but it requires counseling and wraparound services, behavioral health services. Other states are looking at fast access to treatment, and we're looking at all of those strategies in Pennsylvania.
Well, can we shift gears here to another headlining health issue? That is the Zika virus. Pennsylvania is ranking 5th in the number of cases right now. How does that happen?
Well,
we seem so far removed from the sources, but
and we are.
Yeah.
All of the cases, and we posted 95 cases yesterday on our website. All of the cases in Pennsylvania are travel associated. That means someone who resides in Pennsylvania went to a Zika affected area and came back with the disease. So we have no locally acquired cases in Pennsylvania as of yet. And a locally acquired case would mean that someone was infected in Pennsylvania. We are working with the Department of Environmental Protection at doing abatement of places where we know that the mosquito that carries Zika virus lives, mostly in Philadelphia, around those areas. So we have been really studying the Zika virus since January, since the outbreak was first noted. We're in constant contact with the Center for Disease Control. I think your viewers, the most important thing during this time is to apply DEET, a mosquito repellent. And when
I was out golfing
when
this
outside,
weekend,
yes,
and I sprayed myself down.
You have to apply DEET, and also remove standing water, because that's where mosquitoes tend to live. So any standing water in a bird bath or a pond that would be susceptible to mosquito infestation, we're urging everyone to take those precautions.
Should Pennsylvanians be worried?
I think we have to be aware. The devastating effects of the Zika virus are for pregnant women.
Right.
And we have to be aware. As I said, we have to be strong prevention, particularly pregnant women or women planning to have a child. We also have to be aware of the transmission. It's also sexually transmitted, so that even if you were not infected, you could be infected by someone. And the symptoms, 4 out of 5 individuals infected don't have symptoms.
Oh, I was going to ask you what are the symptoms, but there might not be any.
There may not be any, and they're very mild.
But Secretary, some of us were sort of disappointed that Florida didn't act faster and do more earlier on. This is a situation, a condition that stays with the person for the rest of their life. Is it not true?
We're really finding out more and more about Zika. I think what we say is that the Zika virus you're infectious for a number of weeks. They are now finding out, the more cases we have of Zika, that it stays in the body much longer, actively much longer. And I think over the next year we're going to have more research that's going to tell us the specifics on the Zika virus. And really, on a national front, they're working on a vaccine, which they're hoping for over the next 2 years.
And that's a Pennsylvania company. There's a Pennsylvania company that's testing a vaccine in Puerto Rico. Inovio Pharmaceutical?
This means somewhere down the line, though, if you want to get pregnant 5 years after originally contracting this virus, it's still going to affect the baby in the same way, Secretary?
Not at this time. We don't believe that 5 years from now it will be affected. But I would urge all your viewers to talk to their practitioner, their OBGYN, about counsel, because we're having information come every day about Zika.
What can the state do about the sexual transmission of it?
Education. Earlier this year, we provided 2,000 Zika kits, which contained all information, DEET, and also information on the Zika virus. All Pennsylvanians can check our website. We have a very robust education program on our website. That's
Is it on the homepage of your website?
health.pa.gov.
Okay, health.pa.gov.
And
Great.
just click on Zika, and you'll have all known facts on Zika up to the minute. We are meeting, the Department of Environmental Protection and the Department of Health meet on a regular basis, weekly actually, and go over all of the mosquito counts in the state, and we're following this very, very closely.
Okay, well, thank you so much, Secretary, for being with us and talking about these two very pressing issues. We appreciate it. We're sorry we ran out of time. We want to invite you back to check in on these
We'll have her come back and talk about some good health news.
Okay.
Thank you.
We'll be back next week to visit with you again. Tune in next week to Behind the Headlines. We'll see you then.